Hi, this is Dr. Tamara Afroza. Hope you are doing well with good health. So today I am going to discuss about three important medical terminology which becomes confusion for medical students, that is what is gross anatomy, what is applied anatomy and what is clinical anatomy. So first of all, before going to the terminologies, I would like to recommend medical students regarding the book from which I have got cleared about this terminology, that is London Medical Dictionary book. This is very essential and useful books, you can go for it. And another BD Chourashia book is also there, the descriptions is given. So these are very small short points, but if you remember this, the anatomy becomes very easy. Just like first, if I go for what is gross anatomy. So gross anatomy is very similar to the terminology that is macroscopic anatomy. So grossly you are viewing the anatomy. First I come that what is anatomy. We all know this is the study regarding the human body parts and organisms or any animal body parts. So studying the parts regarding is anatomy. So when it's gross, that is in naked eye what you are viewing. Just like if I show this image that what is just one second, this image that is what this image is showing. So you can understand this is after the dissections of the portion skull. Here the dura mater, arachnoid mater, these are showing by layer. So in that way, thorax, abdomen, if we open it, we can go for search of and what body parts is there and which part is regarding above, which organ is remaining, what is this its structure. So what we view in our naked eyes is gross anatomy. If we come for and along with microscopic anatomy, also another terminology that is microscopic anatomy. So microscopic is under the instrument microscope. This type of structure sometimes asks for medical students that which structures you can see and view under the microscope. So here it is the Purkinje cell of the cerebellum structure. So in that way, under the microscope you are viewing the tissues or the structures. So this is microscopic. If we come for the second terminology, that is clinical anatomy. Clinical anatomy is the combination of gross, histological, microscopic and all the applied knowledge to apply in the clinical practice. This is clinical anatomy. Just like if you get the diagnosis of gastric ulcer, you can understand that it's the ulcer on the stomach, esophageal ulcer. So you have the idea and structure regarding esophagus. What is esophagus, where it is situated, and the ulcer on that place is esophageal ulcer. So indications of your anatomical knowledge regarding gross, anatomical, histological and neurological for the purpose of treatment and diagnosis is your clinical anatomy. Last terminology, that is applied anatomy. If I give you the example that you have to go to the roof of an unknown building, that is 17th floor, and in one way you have to go there. So without knowing the structures and where the stairs are, how the route is, you can't go there, right? So this is the applied anatomy, which is an oldest terms and very similar to the clinical anatomy. For the treatment and diagnostic purpose it is used, but it is you are applying your all the knowledge. The question comes in mind regarding this very similar, that is clinical and applied anatomy, right? Basically, that is applied when all senses of anatomical knowledge is usually used regarding the surgical and the body parts opening way. And clinical is for the clinical diagnosis and as well as where to understand that this diagnosis is regarding which clinical organ basis. Hope this will be helpful. Thanks for watching.